All right, let's jump into this deep dive today. We're going to explore something pretty crucial, really, and that's where nursing ethics and human rights kind of, well, they intersect.
Yeah.
We've got a really interesting mix of resources for this one. We've got those professional codes, some academic papers. We even have like real-world scenarios to really bring it to life.
Yeah, I think, for all of you nurses listening and nursing students, you're the ones right there on the front lines dealing with these ethical challenges every day. So hopefully this will give you some tools, some new ways to think about things.
Oh, absolutely. I mean, it can be so tricky to navigate. So first off, we're going to dive right into this code of ethics for nurses.
Mm.
I mean, it's not just, some old document. This is the foundation.
It really is, yeah. It's the ethical bedrock of the whole profession. I mean, it's a framework. It guides us, in how we interact with everyone, the patients and our colleagues, everybody, really.
And one thing that just jumps out at me right away is this idea of respect for human dignity. I mean, it's front and center for good reason.
Yeah,
It's like the very core.
it's the foundation of everything we do, yeah. Seeing each patient, recognizing that inherent worth, regardless of, their background, their beliefs, anything. We respect their values, even when they differ from our own. That's the key.
It's about seeing them as an individual, not a case number or just a diagnosis on a chart.
Exactly.
But, here's the thing, and this is where it gets kind of complex.
Oh, yeah.
Respecting those values, that doesn't necessarily mean that we condone every choice they make.
Right.
So how do we balance that as nurses?
It's tough, but it's a really important point. We can empathize with a patient. We can understand their choices, even if we wouldn't make the same ones. But it's about supporting them, right, in their decision making. But, and this is important, it's while upholding those ethical standards, keeping patient safety in mind.
And that takes us right into this idea of self-determination, the patient's self-determination, which is really all about autonomy.
Absolutely, yeah. Their right to make their own choices, make those informed decisions about their own care. And we respect that, even if we disagree, even if it's tough.
But what if a patient's autonomy clashes with what we believe is in their best interest?
Yeah.
As nurses, that's got to be a difficult position to be in.
Oh, it can be, for sure. We have a responsibility to advocate for them, right? And sometimes that means difficult conversations. It means voicing concerns. Sometimes it's presenting different options. But ultimately, we have to respect their autonomy, all while striving for that best possible outcome.
And this leads to another really important point in the code, acting on questionable practice. It's about, having the courage to speak up if you see something that's unsafe or, unethical. But that can be really intimidating to speak up.
Absolutely, yeah. Especially if it involves, challenging a colleague. Or a supervisor. I mean, patient safety and well-being have to come first. But it's difficult. The code does, though. It gives us a framework for how to approach those situations, encouraging open communication, collaborating to address those concerns. So that's helpful.
But what if, sometimes it's not clear-cut, it's not always black and white. What if you're just not sure? Like if it's truly unethical or just a different way of doing things?
That's where your critical thinking, your judgment come in. The code, it actually encourages us to talk to colleagues, to consult with others, to review those policies, review those procedures, use your knowledge, make sound judgments. It's not easy.
All right, so it's not just about blindly following orders.
Right.
It's about using that experience, that expertise to make sure the patient gets the best care.
Yeah.
Which kind of, I guess, brings us to our next source, which is all about those 4 principles, right? The 4 principles of biomedical ethics. Autonomy, beneficence, non-maleficence, and justice.
Yeah.
These are like cornerstones, right?
Yeah, they really are essential. And thankfully, I think they're pretty easy to grasp. So we've already talked about autonomy.
Right.
So let's move to beneficence.
Okay.
Which is really about acting in their best interest.
It's doing good.
Right. Using your skills, your knowledge to benefit your patient.
And then there's non-maleficence.
Yeah.
Which is kind of like the opposite, like the flip side of beneficence,
Yeah.
right? It's about avoiding harm.
Exactly.
It's about, protecting our patients from anything that could put them at risk. Could be a medication error, a fall, even a, communication breakdown.
Yeah, all of that.
And then there's justice, which is really about, fairness, equity, making sure everyone has access to good quality care, no matter, their background, their circumstances. It's about allocating those resources fairly. And it's about treating everyone with that same respect and consideration.
Absolutely.
And all four of these principles, they just resonate so strongly with the code of ethics. It's
Okay.
like the code takes those, broad principles and makes them actionable. It gives you those guidelines.
Yeah.
But, in real life, it's not always easy, is it?
No, it's not. Nursing is filled with those ethically complex situations, and that's where your critical thinking comes in. You have to weigh those potential benefits, the harms. You have to consider all perspectives, and you got to make those decisions that align with your ethical compass. It can be tough.
So we've got these solid principles to guide us, but then things get even more interesting when we start talking about moral status and advocacy.
Yeah, that's where it gets even more complex.
So our next source, it kind of digs into these concepts, drawing on both the code of ethics and that paper we talked about with those four principles. Um, so let's start with moral status. What is that exactly?
So moral status is basically who or what deserves that moral consideration, and this is something like philosophers have been debating for centuries. So.
Well, that sounds pretty heavy. So how does that apply to nursing, to what we do every day?
Well, when we're making ethical decisions, we have to think about who will be affected by those decisions, right? What their interests are. Moral status helps us to figure out who we need to include in those decisions, whose interests really matter.
So when we're thinking about our patients, how does this play out?
Okay, imagine a patient with severe dementia who can't make their own decisions anymore.
Right.
Their moral status, that might be debated depending on which, philosophical framework you're looking at. And that can lead to disagreements
Mm.
about, what is the right care for them, what's appropriate.
So how do we navigate that as nurses?
Well, a code of ethics is clear. We advocate for our patients, especially those who are, more vulnerable, or maybe they can't speak up for themselves.
Okay, yeah.
We got to make sure their voices are heard, that their needs are met, and that their rights are respected. It's crucial.
That makes me think about a situation I had early on in my career. I had this elderly patient, and they were being pressured to consent to a procedure
Oh,
that
wow.
they didn't really understand. And I just knew I had to step in. I had to advocate for them, for their right to truly make an informed decision.
Yeah, you were a moral agent. You were making sure their rights were protected.
It seems like we're always facing these challenges.
Yeah.
So is there anything in the code that helps us, when our personal beliefs like clash with our professional duties?
Yeah, it addresses that through this idea of conscientious objection. It says that nurses, they have the right to refuse to participate in care that violates their deeply held beliefs.
Okay, so if a nurse felt like a certain procedure was like morally wrong, they could say no.
Yes, but it's not quite that simple. The code also says that a nurse's objection, that can't compromise patient safety, or the continuity of their care.
So you can't, just walk away and leave the patient hanging.
Exactly. The code, it outlines your responsibility to find other arrangements, make sure they're taken care of. It's this balancing act, your personal beliefs and your professional responsibility.
This is so fascinating. We've covered, I mean, so much ground from those basic principles, those foundations, to these complexities of moral status and conscientious objection. I already feel like I have a much deeper understanding of these ethical challenges, that we face as nurses.
Yeah, and we're just getting started. In our next segment, we'll explore how a human rights framework, how that can apply to nursing practice. So you'll have even more tools.
Oh, I can't wait to dive into that. This is such important stuff for anyone in healthcare, really. It really is, yeah. So far we've been looking at, that nurse-patient relationship, all the ethical stuff that comes up there.
Right.
But now we're going to zoom out a little.
Yeah.
Think bigger picture. We're going to look at a human rights framework.
Interesting. So we're moving beyond the bedside, looking at the bigger social context.
Yeah, exactly. And it's crucial, I think, to really understand ethical nursing practice today. In today's world, we're using a bunch of sources for this. We've got some great material from the Royal College of Nursing, and this information pack, it's really comprehensive. It really gets into how to actually apply a human rights approach. It's great.
And that's where the panel principles come in, right?
Yeah.
I've heard of panel, but I'm not sure I really get how they apply to, what I do every day.
Yeah, panel it's an acronym.
Okay.
And it's pretty handy for thinking about things through this human rights lens.
Yeah.
So it's participation, accountability, non-discrimination, empowerment, and legality. Okay, a lot to unpack there.
Yeah.
So participation, I'm guessing this is more than just, getting informed consent.
It is, yeah. It's about creating a culture where patients, their voices are actually heard. They're valued. It's about engaging them, really engaging them in making that care plan, not just, signing on the dotted line.
So it's about collaboration,
Yeah.
real to real shared decision making.
Exactly.
I can see how that would empower patients,
Yeah,
really build that trust.
for sure. So then we have accountability.
Okay.
And this one is all about transparency and responsibility in everything we do, really.
So being open about mistakes,
Uh-huh.
learning from them.
It's that, but it's more than that too. It's about being answerable for your actions, making sure your practice it aligns with, those ethical standards,
Yeah.
with those human rights principles. It's about advocating for systems and processes that really uphold all of that. It's a big one.
Right. So non-discrimination.
Yeah.
That one seems, pretty straightforward.
It is, but it's worth saying, it applies to everything, every aspect of patient care. We treat everybody equally with that same respect, no matter their background, their beliefs, their circumstances. None of that matters.
Right. Right. It's about that equal access to quality care,
Yeah,
treating everyone with dignity and compassion.
absolutely. And then there's empowerment.
Okay.
So we've talked about autonomy, right? But empowerment, it goes a step further.
How so?
Well, it's about, giving them the knowledge, the tools, the support they need to really take control
Yeah.
of their health, their well-being. It's about helping them make those informed choices
Mm.
and advocate for themselves.
I like that. It's giving them that sense of agency.
Yeah, yeah,
Like
yeah.
they can take charge.
And then lastly, legality,
Good.
which basically means, we got to stay within the law.
So knowing the rules,
Ah,
the regulations.
it is, but it's also about understanding that whole legal framework behind human rights, and advocating for laws and policies that protect our patients and our communities. It's big picture stuff.
Yeah. These panel principles, they really are like a roadmap
Yeah.
for bringing those human rights into our work.
Yeah, it's not just some like abstract idea. It's a way of thinking and acting that can really make a difference.
So one of the sources we're looking at, the stuff from the Royal College of Nursing, they highlight these recent investigations into poor care.
Yeah.
And often what they find is it's systemic issues that have led to human rights violations.
Yeah.
Pretty sobering when you think about it.
It is. It makes you realize that, being ethical, it's not just about what you do as an individual.
Right.
It's about fighting for that change, for a system that truly prioritizes those rights.
Absolutely. Speaking of real world examples, do you remember Sheila's story
Oh, yeah.
from the information pack? The one where she wasn't allowed to go out into the garden?
Yeah. That was a tough one.
It's just heartbreaking to think that someone's basic rights could be ignored like that, especially in a care setting
Yeah.
where they should feel safe and respected.
It really shows how, a human rights framework, how we can use that to address these very specific situations.
Yeah.
Her right to autonomy, her wanting to do something meaningful, to go outside, all of that, it was ignored.
Right. It's a reminder that we have to be, really vigilant.
Yeah.
We have to advocate for our patients, even in small ways.
Mm-hmm.
Sometimes just making sure someone can get some fresh air
Yeah.
can be a really powerful way to advocate.
It can be, for sure. Now, the information pack, it also has this tool. It's called the FAIR flow chart. And it's meant to help you analyze those ethical dilemmas. It's like a step-by-step process.
I love a good flow chart. So tell me more.
So FAIR stands for facts, analysis of rights at stake, identification of shared responsibilities, and review actions.
Okay, so first you get all the facts.
Yeah.
Then you figure out, okay, which rights are maybe being violated or
Yeah,
ignored.
right.
Correct, right.
Then you got to figure out who is responsible for addressing the issue.
Right.
Because a lot of times it's a team effort. And then lastly, you review what actions were taken, see if they were, if they worked.
I can see how this would be so helpful. When you're in those gray areas,
Yeah.
when it's not clear what the right thing to do is,
Right.
it gives you that structure for making those ethical decisions, especially when, things are emotionally charged or maybe there are different opinions on what to do.
Yeah. It helps you approach it in a way that's systematic and transparent. You're thinking about everything and making sure those decisions align with those principles and those human rights standards.
So this is all making sense. But before we move on, can we talk a little bit more about those specific human rights that are really relevant to healthcare? I mean, we've touched on autonomy, but I'd love to hear more.
Yeah, yeah. So there are a bunch of core human rights that are central to ethical nursing practice, and they include like the right to life, the right to health, the right to privacy, freedom from discrimination, and freedom of expression. So they're fundamental for creating a healthcare system that's just and equitable.
So the right to life. I mean, that's pretty basic. How does that actually play out in healthcare?
Well, it's more than just, keeping someone alive. It's about protecting them from harm, making sure they get the care they need to survive and thrive. It's everything. Preventing medical errors, advocating for the right end-of-life care that aligns with their wishes.
And the right to health. Does that mean like everyone's entitled to perfect health?
Well, no, not exactly. It's not about guaranteeing that. It's about making sure everyone has access to healthcare services, information, resources
Yeah.
that help them be well. It's about creating those conditions where people can live healthy lives
Yeah.
in the fullest extent possible.
The right to privacy, that feels especially important in healthcare. We're dealing with really sensitive information all the time.
Oh, absolutely. It's about respecting their confidentiality, making sure their information is protected, that it's handled with care.
Yeah.
But it's also about respecting their physical space, their dignity during those procedures, those exams.
Right. And freedom from discrimination, that's another big one. And it really, really aligns with the Code of Ethics.
Yeah.
It's a cornerstone of ethical healthcare. I mean, we have to make sure that all our patients, they're treated fairly,
Yeah.
no matter what, their race, their religion, their gender, their sexual orientation. It doesn't matter.
Absolutely. And then lastly, there's freedom of expression.
Okay. How does that work in healthcare? I'm curious.
Well, it's about creating this environment where patients feel safe to speak up, to share their views, their concerns, without being judged. It's about encouraging them to ask questions, to advocate for what they need, and to really be a part of those decisions about their care.
I see how all of these rights are connected.
Yeah.
And they all contribute to really putting the patient at the center.
Yeah.
It's about seeing them as a whole person with dignity and rights.
Right. Not just a walking medical condition.
Exactly.
Yeah.
Exactly.
So by using this human rights framework, we're going beyond just the clinical side of things. We're thinking about the social and ethical context of everything we do.
Yeah.
It helps us advocate not just for our patients, but for a better healthcare system for everyone.
This has been, eye-opening. I'm feeling inspired to think about how I can bring all this into my work, my daily practice.
That's great. And speaking of putting these ideas into practice, our next segment, we're gonna dig into those specific proficiencies that modern nurses need to handle all of this complex ethical landscape.
Oh, I can't wait to hear more about that. Sounds like we're gonna get some real concrete skills, real tools to make all this happen.
Yeah, for sure.
Okay, so we've talked about those ethical principles. We've looked at this human rights framework. But now, how do we use all this? As nurses, how do we put this into practice? We've got these two really interesting documents to help us with that.
Yeah.
The NMC code and future nurse proficiencies.
Yeah, these sources, they're great. They give us real concrete guidance on what nurses need to, really thrive in healthcare today, especially when we're talking about ethics, communication, all of that, and advocacy too.
So let's start with the NAC code. This sets the standards, right, for nurses in the UK. It tells us, what we're responsible for and the values we're supposed to uphold.
It's like your ethical compass, guiding you when things get a little tricky. And it really does. It reinforces all those human rights principles we've been talking about.
It does. I noticed how the NMC code, it emphasizes treating people as individuals.
Yeah.
Respecting their dignity.
Yeah.
Which is like, that respect for human dignity from the American Nurses Association's Code of Ethics.
Yeah, exactly. It's a universal idea. But the NMC code goes further. It's not just, stating the principle. It's about, okay, what are the behaviors that show respect? Like treating people with kindness, with compassion, not making assumptions, recognizing that everyone is different.
So it's not enough to just, know it. You have to actually do it.
Right.
And all those interactions with your patients, their families, your colleagues, everybody.
Yeah. Yeah. The code, it also talks about really listening, understanding what people prefer, and working with them, really in partnership to figure out what's the best care for them.
That's that patient-centered approach.
Yeah.
It's about those decisions, those shared decisions, and collaborating.
Right. And of course we can't forget about advocating. The code is really clear about our role in speaking up for those vulnerable patients and challenging practices that, might put their well-being at risk or their safety.
Right, being that voice for those who can't speak up themselves.
Exactly.
Making sure their rights are protected, their needs are met.
Absolutely. So now let's look at this other document, Future Nurse Proficiencies. This one lays out all the skills, the knowledge that nurses need, for healthcare in the 21st century. It's changing so fast.
Yeah, it's a lot.
It is. Yeah, it's like a blueprint for what a modern nurse needs to know, needs to be able to do to give that high quality ethical care.
So there are a lot of competencies in here.
Oh, yeah.
Um, but let's focus on the ones that connect to what we've been talking about, with ethics, with human rights.
Right.
Where do we even start?
Well, one of the most important is understanding and promoting well-being.
Okay.
And I don't just mean, physically. It's their mental well-being too.
Right.
Their social well-being. It's everything.
So it's really looking at the whole person,
Right.
recognizing all those different factors that can affect their well-being.
Exactly.
Mhm.
And this document also talks about communication. It might seem obvious,
Right.
but clear communication, compassionate communication, that's key for ethical nursing practice.
It's something that's come up, again and again.
Right.
Communication,
Mm-hmm.
building that trust, making
Yeah.
sure everyone's on the same page. Absolutely. And future nurse proficiencies, it talks about being able to communicate with all sorts of patients, all sorts of families, recognizing when someone's distressed and knowing how to respond, and then working well on those teams, those interdisciplinary teams
Yeah.
to make sure everyone's coordinating care. It's a lot.
Yeah, it's like creating this culture of openness
Yeah.
where patients feel comfortable, they can share what they're worried about, what they prefer, and then all the healthcare professionals, they're working together
Oh.
to meet those needs seamlessly.
Yeah, exactly. The document even gets into like specific things like play therapy and distraction techniques.
Oh, interesting.
Yeah, these can be really, really helpful in certain situations.
So what is that exactly?
So play therapy, that's fantastic for working with kids. It lets them, express how they feel, cope with tough situations all through play. And then distraction techniques, those can be good for anybody, really, any age. If they're anxious or in pain or uncomfortable, it can really help.
So it's about going beyond just, the medical stuff.
Yeah.
It's using that creativity, that compassion.
Absolutely. Now, another proficiency that might seem basic, but it's ethically really important is keeping those clear, accurate records.
Yeah. I get how that's important for, making sure everyone knows what's going on with the patient, but what's the ethical side of that?
Well, good documentation, it's crucial for patient safety
Okay.
and for making informed decisions. It makes sure that everyone who's involved in their care has the right information.
Yeah.
So that the decisions are based on, the whole picture, their condition, their history, everything.
So it's about transparency
Yeah.
and accountability, right?
Yeah.
Making sure that what we do, it's documented
Mm-hmm.
and that we can, explain those decisions.
Yeah, exactly. And finally, future nurse proficiencies talks about upholding those professional standards
Yeah.
and acting with integrity in everything.
So walking the walk, not just talking the talk.
Exactly. Matching your actions with those ethical principles and taking responsibility for your decisions, even when it's hard.
So these proficiencies, they paint this picture of what a nurse should be.
Yeah.
Skilled, compassionate, ethical, ready for anything, ready for all those challenges in healthcare.
It's a lot to live up to, but I think it's exciting, it's inspiring. What stands out to you from all this, from our deep dive today?
What really struck me is that nursing, it's not just about the tasks, the procedures.
Right.
It's about recognizing that everyone we care for has that inherent dignity and respecting their rights, advocating for their well-being. It's about seeing each patient as an individual with their own story, their own needs.
Yeah, that's beautifully said. And remember, making those ethical decisions, that's a process. It's not just a one-time thing.
It's about learning,
Yeah.
reflecting on what happens, talking to your colleagues, thinking things through. It's ongoing.
Before we wrap up, I want to leave our listeners with something to think about. So, how can we as nurses and as a society, how can we work together to create a healthcare system that really upholds human rights and promotes well-being for everyone?
That's a great question. It's something we need to keep talking about, keep working on, really collaborating and committing to those ethical practices
Mhm.
at every level of healthcare.
Well, thank you for joining us for this deep dive into nursing ethics and human rights. Hopefully, this has given you some new insights, some tools that you can use in your practice. Keep learning, keep asking those questions, and keep advocating for what's right.
Yeah. Take care, everyone. See you next time.